Vaccines are given to protect and prepare one's immune system to recognize and fight serious and deadly diseases like polio, measles, rubella, and tetanus. In spite of efforts by the Ministry of Health to get more children immunized, some parents refuse to get their children immunized after a certain period. Others also prefer to give birth at home, exposing the baby to infections. The Concerned Health Education Project has therefore designed a data collection tool to help keep track of the number of children under 5 years in the Ladadi-Kotopon municipality who are immunized.
It is to identify the number of children in terms of population in the various households we attend, and also try to investigate them to find out if indeed some have defaulted in immunization doses. That will also help the municipality in itself to know even the population of under 5 children, and also it will help us as project managers to collate and coordinate our activities effectively.
Senior Nursing Officer for Public Health at the La General Hospital, Christiana Opon, educated the women on immunization, underscoring the importance of it.
When these children are immunized, they are healthy, and it prevents them from getting all diseases, and it also helps the mothers from not going to the hospitals, and then sending the children to the hospital, wasting their time, spending money in drugs. It helps them to prevent all these things.
She highlighted the various vaccines a child should be given before attaining 1 year, 6 months.
When the child is 6 weeks, we give the 5-in-1, which we call hip hep, and then we give DPT2, and we have a vaccine too called PCV. We give that one too. At the age of 1.5 years, every child should be fully immunized against these diseases.
Launching the tool, the assembly trained women groups in the municipality who will in turn educate members of their groups prior to the collection of data by volunteers.
We talk of polio affecting maybe the legs, but today I've learned that it also affects the brain, and it's a way of telling us how serious it is. So as we go back, we should try as much as possible to educate our members, who also intend to educate the community.
Now we have to train our community people how to take their walls or their children to the hospitals, wings, and then for the children to collect the injections. We learn more about it, and the program is very, very good. Interested. Those of them who never knew to give birth, deliver in the hospital, than be in the house is very bad.
The tool will capture the kind of settlement, the educational level, occupation, family size, number of children, number of males and females, age of children, fully, partially or not immunized children, and the number of pregnant women in a household.